Today's news highlights a Swedish population-based case control study indicating that tattoos may be a risk factor for malignant lymphoma. The study, led by Crystal Nielsen, Ph.D., of Lund University, involved nearly 12,000 participants and found that individuals with tattoos had a higher risk of overall lymphoma compared to those without tattoos. The incidence rate ratio, IRR, was 1.21, 95% C 0.99 to 1.48, after adjusting for variables like education, age, income, and smoking status. The association was particularly strong for diffuse large B-cell lymphoma, 1 Iranian rial and 30 dinars, 95% C 0.99 to 1.71, and follicular lymphoma, 1 Iranian rial and 29 dinars, 95% C 0.92 to 1.82. The risk of lymphoma was highest in individuals who had less than 2 years between their first tattoo and the index year, 1 Iranian rial and 81 dinars, 95% C 1.03 to 3.20. This risk decreased with intermediate exposure duration, 3 to 10 years, but increased again for those who had their first tattoo 11 or more years before the index year, 1 Iranian rial and 19 dinars, 95% C 0.94 to 1.50. Nielsen and her team emphasized the need for more epidemiologic research to establish causality. They highlighted the importance of regulating tattoo ink's chemical composition, noting that if future studies corroborate their findings, it could indicate that tattoo ink exposure is linked to both tumor initiation and promotion. Nielsen also stressed that individuals should be aware of potential health impacts and consult healthcare providers if they experience symptoms related to their tattoos. The study pointed out that tattoos have become significantly more popular in recent decades, with prevalence rates exceeding 20% in several European countries and around 30% in the US. Given that many people get tattoos at a young age, they could be exposed to potentially carcinogenic chemicals in tattoo ink for much of their lives. The researchers noted that understanding the long-term health effects of tattoos is still in its early stages. The research analyzed all incident cases of malignant lymphoma diagnosed between 2007 and 2017 in Swedish patients aged 20 to 60, using data from the Swedish National Cancer Register. The study included 11,905 individuals, with 2,938 having lymphoma and 8,967 serving as controls. They found no clear exposure-response relationship between tattooed body surface area and lymphoma risk, but the highest risk was observed in those with tattoos smaller than one hand palm. The researchers acknowledged limitations in their study, including potential selection bias due to elective participation,